Okay, it's my pleasure today as part of the series, what I'm entitling Reflections from Pharmacy Leaders on Advancing the Profession. It's my pleasure to welcome Dr. Tripp Logan this morning, who is the Chief Operating Officer of Enhanced Service Pharmacy Alliance. Upon graduating from pharmacy school with his PharmD from UMKC in Kansas City, he joined the family, joining the Logan family and operating 2 community pharmacies in southeastern Missouri.
Right.
And he's been very active with NCPA and also with CPAN, the Community Pharmacy Enhanced Service Network. So I'll go ahead and we'll start the interview. There we go. Well, welcome. It's my pleasure to have you here. What I like to do is to start off and ask you to, we'd like to learn more about your journey. And I describe you as a pharmacy leader, as you have been working to advance the profession. So maybe start off with, sharing your journey to where you are today, and maybe you want to include key events or even people who have influenced you on this journey.
Yeah, I appreciate the leadership comment. Honestly, that was never my intent. And what we're doing. I'm a second generation community pharmacist. Actually, my father, who's also a PharmD, is sitting behind me, and I took my first steps in one of his drugstores, and this is what we've done my whole life. About 10 or 15 years ago, the business of community pharmacy practice got a lot trickier. We had always been a progressive. I grew up in a progressive environment where we were doing wellness more than just prescription fills, a little outside of the box thinking as I was growing up and going through pharmacy school. But when the business model got tricky, that's when we decided to really hop in and engage. So leadership, call it what you will. I call it, fighting out of necessity to keep our doors open and make sure that our business stays viable. We always say we've got a residency program and students and full, really solid pharmacy team in our pharmacy in Southeast Missouri, and we tell them all the time, our number one priority is take care of the patients of this community, and everyone that walks in the door is a priority. But if we make really misinformed and stupid business decisions, we close our doors, we fail every one of those patients. We can't do that. In today's environment, we're not running a free health clinic. We've got to retain a profit in order to reinvest in our community, pay our staff, and expand the services that we offer locally. And we just have to keep getting creative. And as we get creative, we partner with other people that are being creative, because we definitely aren't the smartest people in the room. And so when we put our heads together with other people being creative, that's what you're probably calling leadership, but we're calling it necessity. We just got to surround ourselves with like-minded people and go out and talk about it. And one of the things we've realized as well is it doesn't really matter what we're doing in our drugstores in Southeast Missouri. If our colleagues aren't doing it around and we can't cover a greater population, then it's not going to do any good, because they're not, partners out there, health systems, payers, employers, they're not going to just partner with a small entity like us. They need more coverage. So that makes it even that much more important. Which goes back to leadership. You call it leadership, I call it, just trying to ensure sustainability of our businesses.
In leadership, there's the big L and the little L, and really what you're talking about is the little L. Leadership is about influencing people to advance, to create change, to advance, in this case, advance the profession. So you truly are a leader. So thank you very much for that. My other question, now this is looking ahead, in 20 years, what do you think will be your legacy? In other words, what are you most proud of in terms of your contributions to help advance the profession?
We keep fighting, so I'm proud of that. We're still here, pretty proud of that. Regarding a contribution, I don't know that I've thought that far ahead. 20 years, we're still operating and in business. It obviously won't look the same, but if we've contributed in any way to others being able to enjoy the benefits of community pharmacy practice, and in their communities being able to enjoy the opportunity to be served by those that are embedded in the community. If we contribute to the sustainability of that 20 years, 50 years, I think that would probably be what I would be most proud of. I've got 3 kids and 2 nephews, and if one of them had the opportunity to be able to do what I do, maybe not the same thing, but be able to give back the way that we have and be embedded locally in the community and serve the patients that we see every day at the grocery store or church, then I'll feel like I've done what I needed to do.
Absolutely. Maybe to describe for us, and I really had the pleasure to hear you for the first time at the AACP interim meeting this past February, and I was really inspired by your words, and I thought that would be important for our students to hear that as well. Maybe share with us a little bit of this, is a little different question, but a little bit more details on some of the enhanced services that you provide and how you kind of developed those, how you saw those as opportunities and took the risk to do those things.
Sure. I think going back to level set, I remember back in the late 80s, early 90s, my dad was trying to start a wellness clinic and check cholesterol and blood glucose, and going to local employers to have them come and focus on wellness in the pharmacy and not just prescriptions. So that kind of thing had always been ingrained in my mind. But we really had, and you can ask anybody on our team in the pharmacies, my journey started with one singular event. I may have told this story at the meeting, but what happened was I was probably 2 years out of pharmacy school, maybe 3. And we were working in the pharmacy, and I heard one of our lead input techs talk to a patient, say, well, hon, we don't have, we'll have it tomorrow. Yeah, yep, we'll talk to you tomorrow. And so I asked Bonnie, I said, what just happened there? And she said, well, so-and-so walked in, and he had 3 prescriptions for really expensive HIV medications. And we were in a small rural community at the time, and we didn't have those prescriptions, didn't have that medication on the shelf. So we proceeded to order $4,000 worth of HIV medication for this newly diagnosed gentleman. Just like clockwork, our wholesaler sent the order in the next day, so the delivery driver brought it in. By the time we opened, we had $4,000 worth of HIV medication on the shelf for this gentleman, and he didn't show up that day. 2 weeks later, that medication's still sitting on the shelf. Dad looks at me and says, Tripp, send this back. We've got $4,000 worth of medicine sitting on the shelf. So I repacked it, sent it back to the wholesaler. 2 days later, guess who shows up? The gentleman. And we looked at each other like, we failed. We failed him. We failed. We bought this medication. We're on the hook for that. The credit's not going to come for a while. We didn't call him. We didn't call the infectious disease clinic to let them know he wasn't getting it. We didn't reach out. We did nothing. And so we completely changed the way that we proactively managed patients at that point. Over the course of time, what we did was we just started assigning technicians to manage panels of patients that we felt were either complex, needed extra help, were high risk of falling off of therapy, or were just really expensive to manage. And as we did that, we came up with a workflow, and this is back in the mid 2000s, workflow around that, and it was working. And so in 2009, I think it was, the National Alliance of State Pharmacy Association engaged with Pfizer to test out the appointment-based model, which is where MedSync came from. And we had been managing patients for a long time, and so we participated, and we weren't really doing MedSync 100% of the time because a lot of our people were real complicated, and we couldn't sync them, but the stable people we could. But we were proactively managing. And so what we did was we participated in that pilot, and along the way, Pfizer kept calling us and saying, hey, and they were asking us more questions beyond just what we were reporting. And our numbers were really positive from an adherence standpoint, from all the metrics that they were looking at. Pfizer, the executives actually they were doing the study, flew down to our area and came in and sat down in L&S Pharmacy in Charleston, Missouri to talk about what we were doing different. And so when they did, they put out a couple of reports based on our model, and we were some of the higher performing pharmacies in that appointment-based model pilot that was done. That really launched MedSync. So after that, once it was published, we started getting a lot of attention from other pharmacies. Say, hey, would you help us? And trade associations would say, hey, can you come speak at this conference and talk a little bit about what you're doing? So we started doing that. And that's where we really began understanding the environment a little more broadly. The metrics involved, very important. We're not the only ones that have metrics attached to us in pharmacy. The medical providers, the primary care providers, health systems, payers, health plans, everybody's got some metrics involved, and we can impact those. So that led down the path of, I did a speaking engagement at the Pharmacy Quality Alliance, PQA, which is where a lot of the adherence metrics and some other measures that are incorporated in the Medicare Part D health plan star ratings program are embedded in that. The PQA helped develop, and they maintain the measures. I've been working in measure development leadership with them for probably 8, almost 10 years now. I currently serve as a NCPA, the National Community Pharmacists Association liaison to their board. I've been there for several years. I'm on their quality metrics expert panel. Part of my mission there is to be the independent pharmacy voice. So that led us down one path, but then as we were also out speaking and talking about things that we were doing in our pharmacy, it helped us come together with a lot of other progressive pharmacy owners that were doing similar things on the speaking circuits. That's what got me involved with the Community Pharmacy Enhanced Services Network, CPESN. And so what that is it's a network of over 2,600 now, independent, mostly independent, some not, community pharmacies, and we act as a clinically integrated network of pharmacy providers. We can contract single signature. We've got contracts with health plans and different payers, different entities out there, and we just, our group of pharmacies that are doing things just a little bit different have just exceeded the numbers of Rite Aid. So we're turning into a national force. And that's good. It's good for the profession, and it helps give us an avenue to do those things we've been trying to do for years and just hadn't had the ability to do because we didn't have the scale.
Right. I appreciate that detail. Yeah, that gives us a pretty good insights into your leadership. So the next question has to do with advice for students. What advice would you give students in their professional journey, especially as they develop as a leader? A leader, again, that doesn't mean a big L, like a leader like you are. What would be some advice?
Well, I'll just walk you through what we do when we have students and new residents coming through our sites. Is we give the example of the patients walking in, and our responsibility is to them. And if we make bad business decisions, we can't serve, and that's key to what we try to share. Also, with students rotating through many pharmacies, I would encourage them not to accept, this is the way we've always done this, and so this is right. Ask questions, learn why. Try to slowly improve and leave your mark on every pharmacy practice that you rotate through, because in aggregate that turns into evolution and positive change. Don't just accept things the way they are. Ask questions, be inquisitive, and try to leave your mark everywhere you go.
Great. I really appreciate that. Great insight. Now, the last question I have, this is a history. In 20 years, we'll be studying the decade of the 2020s. And one of the significant event in 2020 will be the COVID-19 pandemic. And like other events that happen in history, I believe that this pandemic will be also a major milestone or turning point in our profession, which sort of gets to the opportunities for the profession during this time. So please comment on that for us.
Yeah, it's been interesting. It's almost like every day is the same, but then you flip the page and every day is totally different. We've had to evolve really quickly. There's some good and some bad. As far as good, I think there's been a greater focus on what services and what opportunity community pharmacy has in this environment and how accessible we are. We've been saying that for years in circles I run, and how accessible we are, and we have all these touch points. But that's really coming to fruition now, and we're seeing a deviation between those that are accessible and those that are remote. Telepharmacy, telemedicine, it's all really important right now, but then people need local testing sites. You've got mail order prescriptions, which a lot of people are getting not only prescriptions, but they're getting their daily supplies and food and whatever via the mail. But then also you need some local places to access prescriptions for immediate need and for counseling and so on, and then home delivery. We've been really ramping up our deliveries here lately. So those things are really positive. Also, there have been a lot of the regulations that have been lifted a little bit and given us the ability to do a little more than we have through different waivers during this COVID-19 situation, and that's both at the state and the national level. It's exciting. Still don't really know what that's going to mean after this, but it's a great time for us to tell our story right now. Hopefully this ends up in a place where we look back, to your point, years later and say this was a tipping point to where we were able to really highlight what community pharmacy can do and what pharmacists can do when they've got access to patients, and how we can be deployed as some really key members of the healthcare system when oftentimes we've just been looked at historically as a dispensary, but really is go out as healthcare providers and help and be extenders from all those entities that need reach into local communities, and particularly rural areas. So it seems to me like in these super urban areas where there are a lot of independent pharmacies, in these rural areas are where we're hearing a lot of need, and hopefully we successfully fill that need. That's the goal.
Wonderful. Wonderful. Very good. This will be very helpful for our students. Well, I thank you for your time.
Sure.
Thank you.